Hello, in this video we will discuss about the diabetes mellitus 1 and 2. So basically collectively we will understand what is diabetes and their physiological aspect and pathophysiology. So let's begin to understand during the digestion. So first of all, the function of the pancreas and the function of the liver and muscle cells, which that is also related to the diabetes. So in this way here is the carbohydrate, which that is made up of sugar molecules, the monomer. So when go into the food into the stomach after the digestion into the oral cavity, go into the stomach as a bolus, and this bolus will go into the duodenum as a chyme after the digestion of the protein. But in this case we will not understand about that things. So we will just understand about the diabetes. So here is the pancreas. Pancreas contain exocrine and endocrine hormones. In this way, endocrine hormone is in the form of islet of Langerhans. This islet of Langerhans contain a pancreatic beta cell, alpha cell, and delta cell. Beta cell produces insulin while glucagon produced from alpha cell and delta cell produce somatostatin. So the little bit growth due to the delta cell. So this is known as the pancreatic acinar. So let's begin to understand the beta cell function and their molecular biology if we will discuss. So in this way here is the transcriptional factor HNF1A and HNF4A, which that is lead to produce the insulin. In this case, the protein from the transcription to translation, and this vesicle in the form of vesicle of the insulin contain protein. Insulin is a polypeptide. So here is the stomach will lead to increase the GIP. This GIP will be bound with the GIP receptor, glucagon like insulinotropic hormone, which that is bind with the beta cell and to stimulate the sugar influx through a 1 sodium ion move inside from a GLUT transporter channel 2. And in this way the glucose will enter and glycolysis to produce pyruvate and go into the mitochondria to produce more ATP aerobically, and this ATP will lead to inhibit the potassium channel and the efflux of the potassium will be closed. In this way the depolarization will be occur. This depolarization will increase the positive charge inside while the outside is the negative, is opposite. So in this way here is the potassium will lead to increase the calcium channel open for the repolarization, so the calcium will move inside, which that will be trigger the vesicle of insulin will go into the endocrinally into the bloodstream. So in this way the insulin will be produced and will bind with the insulin receptor, which that is present in the all type of organ tissue, and this basically is the insulin receptor are present, which that is when bind the insulin. Here you can see and understand here is a GLUT4 channel are present in the muscle cell and liver cell as well as adipose healthy condition if we will discuss. This is the healthy condition. So inside the GLUT4 vesicle. In this form, the GLUT4 vesicle contain a 4 GLUT transporter channel will bind after the stimulation of the insulin receptor, will bind to G-coupled protein receptor, will trigger the to increase the basically GLUT4 vesicle. So basically is the G-coupled protein or something. So you can see and understand basically the signal ligand is the insulin, which that will lead to produce the GLUT4 will bind with the cytoplasm. So this is the healthy, while if we will discuss about the diabetic cell or diabetic condition. So in this way the lack of insulin receptor fail to sense insulin. In this way the sugar level will be high in the blood into the blood, will lead to not move inside due to the GLUT4 transporter. A vesicle will not bind with the cytoplasm, and in this way the glucose will be move again into the blood circulatory system and is known as the hyperglycemia. On the other hand, the adipose tissue will be bind And in this way, when adipose tissue will be burned, the glucose will move inside, and triacylglycerol formation is known as the lipogenesis. While in the case of diabetic, free fatty acid will be produced is known as the lipolysis. And in this way, the ketone is also produced from the free fatty acid into the liver, which that is lead to ketoacidosis due to the proteolysis from the protein breakdown to increase the ketones and is keto acid from the amino acid. So here is the sign and symptom if we will discuss about the diabetes. So the increased thirst, frequent urination due to the excess of the glucose will excrete from the urine, and increase the hunger and weight loss, fatigue, blurred vision, slow healing, and the frequent infection, area of darkened skin in the armpit and neck, and polyuria, polydipsia, and polyphagia. This is the symptom. Polyuria means the again and again urination, while the polydipsia means the again and again drinking, while the polyphagia is again and again eating. So here is you can see that is we will discuss about during the excretion. So the sugar will be higher in the blood circulatory system will be filtered for homeostasis, for level normal into the blood circulatory system. So for normal, so here is the proximal convoluted tubule, distal convoluted tubule, and loop of Henle and collecting duct of the nephron. So in this way, here is the glycouria as well as the loss of water and hypokalemia due to excess of potassium loss and calcium loss. So the calcium is also lost and not absorbed due to the excess of the glucose will be excreted through a ureter in from the kidney, and loss of weight. Why loss of weight? Because the decreasing of the glucose and lipolysis will be occur due to the damage of the receptor of the adipose tissue. So the sugar will not move into the adipose tissue. So on the other hand, the sign and symptom if we will discuss on the basis of the excretion. So the polydipsia, why? Because the water loss, and polyuria, why? Because the excretion of the glucose again and again. So the loss of water and polyuria is interconnected. And the polyphagia, why? Because the loss of sugar will lead to increase the hunger, appetite, and in this way the increase the appetite will lead to increase the polyphagia, again and again eating. So the frequent thirst in increase, excrete amino acid salts and mineral, lead to calcium loss, weakness of bones, and muscle fatigue due to the movement of muscle is through calcium as well as the nerve impulse is through a calcium. So it means the nerve damage. So the action potential will disrupt. On the other hand, the brain fog can be occur. So on the other hand, the diabetes mellitus 1, if we will discuss, this is the autoimmune disorder. It is genetically, and in this way, the here is the B cell, and this is the B cell we convert into the B memory cell. But in this way, you can see here is the insulin will be used as an antigen we recognize, and the piece of the antigen of the insulin will be represented by MHC class 1 receptor. So MHC class basically. So this is the molecule and will be represented by the CD4 receptor of the T cell with the T cell receptor, and in this way the piece of the antigen will recognized by the dendritic cell with a T cell receptor and CD4, and in this way the dendritic cell and CD8 receptor will recognized by the T cell containing a CD8 T cell. This CD8 T cell will recognize, and after this is the regulatory regulation, and in this way it will be recognized, and the destruction of that, and the B cell produce the auto antibodies which that is bind with the cell of the beta from the pancreas will bind and the inhibit the activity of the beta cell, while the T cell which that is used for the destruction of the cell by a mechanism. So this is the diabetes mellitus 1, which that is lead to autoimmune disorder, and it is basically is the some genetic. Uh, on the other hand, here is the disease. We will discuss if the disease can be occur. It is the cardiovascular disease, which that is in the form of arteriosclerosis, the thickness of the and hardening of the blood vessel, while the arteriosclerosis is the plaque formation of the lipids. So the lipid plaque formation we will discuss later in this video. So the coronary heart disease occur due to the coronary artery constriction, and the plaque formation is the atherosclerosis or arteriosclerosis. So in this way, the basically that is the cardiovascular disease. On the other hand, the neuropathy is the brain fog, nerve conduction loss, and coma, and the forgetfulness and loss of pain, and infection is also occur. On the other hand, the nephropathy is due to the loss of high blood volume of water and glucose, which that is damage the filtration area. In this way, the glomerulus filtration rate and the Bowman capsule disrupt, and the filtration will be damaged, and the loss of the protein is too much, is known as the another glomerular nephritis. So the calcium, sodium, potassium from nephron will be released, and loss of the glucose also. So the retinopathy, eye not feed glucose, will lead to blindness, and the skin and hearing impaired is also. Why? Because these organs require the glucose too much, and in this way, the basically the glucose will not use due to the diabetes mellitus 2. Basically not diabetes mellitus 1, but it is related to the diabetes mellitus 2. Why? Because the diabetes mellitus 1 is depend to the insulin, but this is the independent for insulin. So here is the vascular changes in diabetes we will discuss. So the vascular changes mean the arteriosclerosis or atherosclerosis will be occur. So here is the blood vessel which contain lumen, and here is the endothelium, and inside is the tunica intima, and the tunica media is inner, is known as the smooth muscle layer, and this smooth muscle layer is used for the contraction of the artery and vein for the blood pressure regulation. So I hope you make sense from this. In this way here you can see the glucose. These glucose are present in the lumen, in the blood. So in this way this glucose will be moved into the endothelium. So the endothelial cell is basically not contain a insulin receptor, and the glucose will be directly absorbed into the endothelium. That is the important things, and that is why it will be moved into the endothelium, and after going to the mitochondria to produce ATP more, and this ATP will lead to advanced glycolylated product is the AGP, and this advanced product will lead to enhance the PKC, protein kinase C, and this protein kinase C will be also promote the ATP production from the mitochondria also. And in this way the protein kinase C will lead to increase the VGF and vascular growth factor, and the growth factor basically increase, and in this way this here is in the lumen is the low density lipoprotein are present basically. So throughout the circulatory system contain low density lipoprotein, for example. Why? Because the lipolysis is occurring, so increase the low density lipoprotein. So this here is a protein kinase C will also lead to increase the endothelin activation, and on the other hand also activate the tumor necrotic factor kappa B increase, and this will lead to increase the monocyte permeability, vascular permeability, as well as the platelets aggregation. So in this way the platelets will be aggregate, and that means the clotting will be occur. So here is you can see that is another thing. In this way the basically the LDL will be enter, but the important thing is that the permeability will be increased due to the vascular permeability through a necrotic factor kappa B, and this necrotic factor kappa B will lead to increase the monocyte inside, as well as the low density lipoprotein also go inside due to the increase of the inflammation. Due to the reactive oxygen species will be produced from the advanced glycolated products, AGP will lead to increase the reactive oxygen species will damage the endothelium. And in this way, the damage the endothelium and the rupturing of the plasma membrane will basically increase the infection as well as increase the inflammation, will lead to increase the basically LDL permeability, and in this way the monocyte will be converted into the macrophage after the proliferation, and this macrophage will produce the tumor necrotic factor alpha and interleukin 1, which that is increase the inflammation. This inflammation will also increase the macrophage, and in this way the engulfing of the LDL through macrophage due to the LDL itself produce the reactive oxygen species and inflammation, and this engulfing of the LDL from macrophage will convert the macrophage into the foam cell, and this foam cell will be stored in the tunica intima between the tunica media and endothelium. So I hope you make sense about these things. And in this way you can see and you can understand basically the foam cell. This foam cell will be rupture. After the rupturing of the foam cell will the deposition of the lipids deposition and the collagen formation to clotting of the lipid will be more strong. And in this way it will be increase the vascular change, and in this way the metabolic changes, atherothrombosis, and micro and macrovascular complication. And the micro and macrovascular complication, in this way the smooth muscle will be increased, and the proliferation of the smooth muscle due to the growth factor, and this growth factor will increase the angiogenesis also into the lipids deposition, and it will lead to artheroma and the heart stroke or blood clotting as the function. So thanks for